Simvastatin is an example of an HMG-CoA reductase inhibitor, also known as a statin. Statins have been the main evidence-based treatment of patients with hypercholesterolemia since the mid-1990s. Statins have a proven track record of reducing the risk of developing cardiovascular disease, the recurrence of CVD events in patients with established ischemic heart disease, and also those with genetically inherited familiar hypercholesterolemia with or without established CVD1. To understand the function of these drugs, we must take a closer look at a liver cell. This is where the HMG-CoA reductase enzyme converts HMG-CoA to mevalonic acid, a cholesterol precursor. This is a rate-limiting step, so by inhibiting this enzyme, statins effectively reduce cholesterol concentrations in the liver cell. Liver cells will sense this reduction in cholesterol levels and react and compensate by synthesizing more LDL receptors. These in turn bind and internalize LDL that may be circulating in the blood. Furthermore, low intracellular cholesterol levels result in a decreased secretion of VLDL, which also contributes to lowering triglyceride levels. Lastly, statins may also increase HDL levels by mechanisms that have not been fully understood yet. Here we have the 3D structure of the simvastatin molecule, complex with the Simvastatin Synthase enzyme found in an Aspergillus terreus, which is a type of fungus, commonly found in the soil. The parts in red, yellow, and orange illustrate the enzyme, the Simvastatin Synthase enzyme, and the molecule in green represents the simvastatin drug. The parts in orange and yellow highlight the amino acid residues within the protein that serve to form the protein pocket, and in yellow are those residues directly and specifically interacting with the simvastatin drug. Here, PyMOL was used to further emphasize the protein pocket. The dot work in yellow displays the areas of effective binding between the drug and the amino acids present within the pocket. Specifically, these dots surround the areas within the protein where polar contacts and electrostatic interactions will occur between the drug and protein residues. Here, the drug-protein interactions occurring within the protein pocket have been illustrated. The green dotted lines represent any and all polar interactions occurring between residues within the protein pocket. The blue dotted lines represent the polar contacts between the simvastatin and the protein residues. The labels showing numbers in angstroms represents the strength of these polar interactions, such that the smaller the value, the stronger the interaction.